The next item of business today is a members' business debate on motion number 8516 in the name of David-Stewart on the Melbourne Declaration. This debate will be concluded without any questions being put. I would invite those members who wish to speak in the debate to please press the request to speak buttons now or as soon as possible. Mr Stewart, if you are ready, 7 minutes to open the debate, please.
Thank you very much, Presiding Officer. A few short months ago, I strolled in the Melbourne summer sun from my hotel to the Victoria State Parliament House. I was due to speak to an unusual audience. Nearly 100 national champions for diabetes, from as far afield as Russia, Ukraine, Nigeria, Canada, and from South Africa. We even had their own First Lady.
Mr Stewart, just 1 minute. Could I ask the members of the gallery also leaving to do so quietly, please? Thank you. Would the members of the gallery please leave quietly? Mr Stewart, please resume.
Thank you, Presiding Officer. It was a privilege to be asked by the International Diabetes Federation to represent Scotland at the first ever Global Forum of Parliamentary Champions for Diabetes. The next forum will be in Canada in 2015, and I hope that Scotland will be represented again by other members, such as Annette Milne, who, along with me, convenes the cross-party group on diabetes. The conference concluded with the signing of the Melbourne Declaration, which committed parliaments across the globe to ensure that diabetes is high on their political agenda. The Declaration called on nations to have a higher emphasis on preventative work, early diagnosis, management and access to adequate care, and to ensure treatment and medicines are available for all those living with diabetes. The Declaration was the brainchild of the International Diabetes Federation, the president of which is Sir Michael Hirst, former MP and ex-chair of Diabetes UK. Presiding Officer, I was proud to talk to the conference delegates about Scotland, but also about issues of international significance for diabetes. And I'm proud to count a nation with a strong track record in innovation and discovery. Scots like Alexander Fleming, who discovered penicillin, Scots like James Watt discovered the steam engine, and Scots like Alexander Graham Bell, who discovered the telephone. But international collaboration is where real strides can be made. In 1922, Presiding Officer, Professor John MacLeod from Aberdeen worked with two outstanding scientists, Dr. Banting and Charles Best, and discovered insulin. MacLeod and Banting won the Nobel Prize for Medicine in 1923, shared with Charles Best. But fast forward to today, and as co-chair of the cross-party group on diabetes and convener of the Public Petitions Committee, I've worked with politicians, the public, medical experts and campaign groups to be an evangelist for diabetes. But as a non-diabetic, why am I so passionate about this subject? Well, in 1997, as a freshly elected, fresh-faced MP, much as that might seem difficult to recognise today, I was given a tour around the diabetic unit at my local hospital. I met a diabetic nurse who encouraged me to take an interest in the subject. She told me diabetes is the main cause of blindness of people of working age, responsible for half of all the non-traumatic lower limb amputations, and cost the NHS then £500 million. I joined the cross-party group in diabetes and became its secretary for 8 years. As part of my duties as secretary, I hosted a reception in the Commons for MPs, peers, patients, doctors, nurses and NHS bosses. There was a couple of 100 guests, and I met the star attraction. Gary Mabbitt, and football fans in the chamber will know, is the ex-captain of Spurs and an English internationalist. He has diabetes, but he told me when he was preparing to leave home to travel to Mexico for the World Cup, he received a phone call from the English team doctor who told him he couldn't go to Mexico, it was too hot and he couldn't cope as a diabetic. A ludicrous decision. He was probably the fittest person in the team, but in my view, a clear example of discrimination against diabetics. We also heard about newly diagnosed diabetics being sacked or downgraded in the police, the fire service or the armed forces. The other event that focused my attention was personal. My late father-in-law had type 1 diabetes for over 70 years. He lost sight in one eye, and he taught me that it's possible to lead a normal life with well-controlled and well-maintained pen needle injections. Last time I asked a parliamentary question to the Minister, I was told there's approximately 250,000 people who are diabetic in Scotland, a further 620,000 who've got a high risk of developing type 2, And in addition, 49,000 people have the condition in Scotland and are undiagnosed. That means there's approximately 1 million people in Scotland who are directly affected by diabetes, so they're having it or being at high risk of developing it. That means, Presiding Officer, my maths are right, which is no guarantee, there are about 800 undiagnosed diabetes sufferers in each Scottish parliamentary constituency. That would mean scores of staff in this Parliament and perhaps 1 or 2 MSPs have diabetes without knowing it. And I believe that screening for type 2 is vital, but it requires planning that tackles local needs with a national framework. So the key is targeting such as interventions to the most good. So we should view screening as a form of prevention rather than cure. So that would allow GPs, or indeed diabetic and practice nurses, to offer it early to patients who are most at risk, who are normally people over 45, who have a family history and are overweight. So early detection is vital, and Diabetes UK Scotland report that most people with type 2 suffer the condition for between 3 and 7 years before diagnosis. So early detection will reduce the number of patients suffering from complication and reduce costs. And that detection can be done by simple and inexpensive urine or blood tests that take about 30 seconds. Now, of course, Presiding Officer, there have been some strong positive steps in the care of people with diabetes, such as the provision of insulin pumps for those under 18. But the number of people with the condition is rising, which will have a serious effect in Scotland's immediate future. Beyond the grave social costs of this condition on individuals and families, there's the huge economic costs to the NHS in Scotland, estimated at £1 billion annually, 80% of which goes in managing avoidable complications. With the Melbourne Declaration on Diabetes focusing on prevention diabetes, the Scottish Government must have a focus on the condition that properly affects the size of the problem. There are now more people living with diabetes in Scotland than with coronary heart disease. 2.5 times more people have diabetes than all cancers combined. And each year in Scotland, 1,900 people have an emergency admission for diabetic steatosis, a critical life-threatening condition that requires immediate medical attention. And over 40% of these admissions are for people under the age of 25. People with diabetes account for 1/5 of hospital inpatients at any one time, and a person with diabetes can face a reduced life expectancy of up to 14 years in Scotland. Diabetes is a leading cause of blindness in working age and a main contributor to kidney failure, amputations and cardiovascular disease, including heart attack and stroke. People with diabetes should be getting their 15 healthcare essential checks from the NHS, and previous action plans have been instrumental in taking this forward. In conclusion, Presiding Officer, we have a great opportunity in Scotland to raise the bar in healthcare. Scotland is one of the highest incidences of type 2 in the world. It's time we tackled the ticking time bomb. Not only would it be cost-effective, it would, on an individual basis, tackle a condition that blinds, maims and kills. Thank you.
Thank you. Now call on Stuart Stevenson to be followed by Malcolm Chisholm. 4 minutes or thereby, Mr Stevenson, please.
Thank you very much, Presiding Officer. And let me congratulate David-Stewart on securing this important debate. Like others, I will congratulate the Global Parliamentary Champions for Diabetes Forum that was held in Melbourne last year, organised, of course, by the International Federation. I understand that parliamentarians from 90 countries have signed a commitment to establish a Parliamentarians for Diabetes Global Network. It is, of course, a global crisis as well as one here in Scotland. There are some 382 million people around the world with diabetes, expected to rise to perhaps 600 million by 2035. It will probably cause 5.1 million deaths in the current year. That's 1 every 6 seconds. It's an economic issue as well as a social and health issue, with 80% of people who have diabetes living in low and middle income countries, and an annual world cost estimated to be around £330 billion. So that's a very significant issue at a whole series of different levels. But more fundamentally, we've seen that the number of diabetics diagnosed, and of course it's partly because of better diagnosis and screening, continues to rise. In Scotland, it's rising at something like 4 to 5% per annum, the number of people go on. Now, the Melbourne Declaration identifies 3 specific areas where action could be taken. That is in prevention, in increasing early diagnosis, and in improving access to care and to therapies. In Scotland, we've had the Diabetes Action Plan, an excellent way of focusing on some of the issues, and in particular seeking to reduce obesity, which is a primary cause of type 2 diabetes. Because, as we've heard, and I have some limited personal experience, there are a whole series of secondary consequences, amputations, blindness, and so on and so forth, that diabetes carries with it. The Scottish Government has substantially supported diabetes research organisations, providing £10,000 a year to Diabetes UK in the current year. I myself am lucky because I have an annual medical that I, at least in the last 12 months, know I'm not subject to diabetes. But the simple urine test that comes as part of that medical is a kind of reassurance that I hope more and more people across Scotland have. I have in my own family and in Australia some direct interest in this. My nephew, Alan Baxter, is a professor who specialises in diabetes at James Cook University in Townsville in Queensland. He established that facility, and he's one of a range of scientists around the world who've come up with some remedies. He has come up with one variant of an inoculation for type 1 diabetes. One of the variants, many of them are genetically driven by a series of different triggers, that is designed to switch off that trigger. So I hope that he and the very many other doctors and researchers who are working to address the causes and effects of the disease continue to undertake the good work they do, as our policymakers must do in supporting them. The Melbourne Declaration on Diabetes has put diabetes on the world stage. I hope that we in this Parliament will add our parliamentary weight to this worldwide parliamentary initiative. Presiding Officer.
Many thanks. Now call on Malcolm Chisholm, to be followed by Nanette Milne.
President, I'd like to start by congratulating David-Stewart on bringing forward this important motion, and also pay tribute to his passionate championing of this issue over the last 17 years. Since his motion also commends the International Diabetes Federation, I think it's appropriate to pay tribute to the work of Sir Michael Hirst as president of that organisation. It's really a great honour for Scotland, and of course, as some members will know, he was a former Conservative MP. Now, the motion refers to both the Melbourne Declaration and the World Health Organisation, and through those references, we'll learn about the great increase in the numbers of diabetes worldwide. And if we look at Scotland in relation to that, we find that the numbers with diabetes have increased from 150,000 when the first framework was launched in 2002 to 258,000 now. And that, of course, doesn't take account of the many who are undiagnosed. I think the figure of 46% of type 2 diabetes being undiagnosed is generally accepted as a good guide. So much of the increase, of course, is driven by type 2 diabetes. I think it's only 11% who have type 1, so clearly the vast majority have type 2, and that, of course, is very much driven by lifestyle factors, which leads to the whole issue of prevention. The Melbourne Declaration emphasised prevention, early diagnosis as well as care, as Stuart Stevenson reminded us, and clearly for type 2 in particular, prevention is absolutely crucial. So, as well as the importance of the general prevention programmes in relation to exercise diet and so on. Support should also be given, I think, to activities which aim to raise awareness of the risks of diabetes, which perhaps are not so well known. So I certainly support the work, for example, of Diabetes UK Scotland with their roadshows in local communities. There also needs to be a more focus on early diagnosis, and again, Dave-Stewart covered this, particularly in relation to effective targeted screening programmes. Perhaps the Minister will say something about this. I'm not quite sure where we are at in relation to screening, but clearly with so many being undiagnosed, is there a need for that? There has been progress through, for example, the focus on diabetes within the Quality and Outcomes framework, and I know GPs do a lot of good work in relation to diabetes, which they didn't do before necessarily, but I don't know whether that really does encompass screening or not. There's been other progress, a lot of progress really, over the last decade. For example, screening for retinopathy. There's a high uptake of that, and clearly blindness is one of the very serious potential complications of diabetes, and many other great advances. Certainly, I remember in 2002 when the first action plan was launched. When I was the Minister, I was a great admirer in particular of the work being done in the Tayside Managed Clinical Network for Diabetes, and the Minister was very lucky, of course, to have the main driving force behind that, Professor Andrew Morris, as his Chief Scientist at present. And we should pay tribute to all the great work he's done. He's really done internationally recognised work in relation to diabetes, for example, in terms of the Diabetes Register, and more generally in terms of work on the therapeutics and genetics of diabetes. So we have a lot to be proud of in Scotland when it comes to diabetes, but clearly the focus of this, as in other health debates, has to be on what more needs to be done. Insulin pumps is an issue that Dave-Stewart mentioned, and again he's done a lot of work in relation to that. I had a constituent at my surgery 2 weeks ago saying her daughter's wasn't getting blood sugar control through the normal means, and was asking me to write to NHS Lothian about the provision of an insulin pump. So I hope she will get that if it's appropriate for her, and I hope they will become more generally available. But my last word is perhaps it's time to update the action plan, and certainly there must be a recommitment in that to bringing down the numbers of those who have diabetes, and also continuing to improve the care of those who do have it.
Many thanks. Now call on Annette Milne to be followed by Cara Hilton.
Thank you, Deputy Presiding Officer. I'm very pleased that David-Stewart has secured this debate following his attendance at the recent meeting in Melbourne, which culminated in the signing of the declaration we're discussing today, and I thank him for it. I'm sorry I was unable to get to that meeting in Australia, but I'm delighted that it secured the support of parliamentarians across a wide diversity of nations. I'd also like to congratulate my good friend Sir Michael Hirst, Mickey to those who know him well, on his efforts to tackle the growing scourge of diabetes through his work with Diabetes UK over many years, and the International Diabetes Federation, of course, of which he is now currently president. Mickey has taken a very active part in efforts to secure the early diagnosis of diabetes, and to ensure that those who have it receive effective glycaemic control, to avoid the awful complications which can result from the condition if blood sugar is not kept within a normal, stable range. He's also been actively involved in studies of the emotional and psychological problems associated with particularly type 1 diabetes in the transitional adolescent years between childhood and adulthood, a time when it's all too easy to let it get out of control. To digress just a little, Presiding Officer, I'm very pleased that the Health and Sport Committee has taken my concerns about transitional care on board, not just in diabetes, but in several other long-term conditions, and is having a roundtable discussion with experts in a few weeks' time to find out just how these transitional years are being dealt with, and how they could be improved for the young patients involved. As we know, diabetes of both types, but particularly type 2, is on the increase across the globe. And in Scotland, the number of people with diabetes is growing at an average annual rate of 4 to 5%, which means that if trends continue, there will be 350,000 people in Scotland with the condition by 2030. Just think of the effect that that will have on the NHS, leaving aside the other pressures of an increasingly ageing population. And we know that over 600,000 people in Scotland are at risk of developing diabetes, so it's crucially important to have an action plan which aims to reduce its prevalence, particularly type 2, where the increase is explosive. Closely aligned with the increasing incidence of type 2 diabetes, of course, is the increasing obesity within our population. with 64.3% of adults in 2012 being classed as overweight, and getting on for half of them being obese. 16.8% of children in 2012 were obese, were overweight, with a further 13.8% at risk of being obese. So all credit to those behind the Melbourne Declaration, who want to see more preventative work with early diagnosis and access to adequate care, treatment and medicines for all who are living with the condition. We are a bit ahead of the game in Scotland compared to some other countries, thanks to the strategic approach taken by successive governments, from the publication of the first Scottish Diabetes Framework in 2002 to the 2010 Scottish Diabetes Action Plan, although there are disparities across different parts of the country. But clearly more needs to be done to bring down the rate of increase of diabetes by an effectively targeted screening programme for diabetes and support for activities which raise awareness of the condition in local communities. And Malcolm Chisholm mentioned the Diabetes UK roadshows, which is a case in point. Our successes so far lie in the greater availability of insulin pumps, particularly for the under-18s, fought for very hard by the cross-party group in this Parliament, which can achieve better glycaemic control in those for whom they're suitable, in better staffing levels of specialists in diabetes, both nursing and consultants, and in the National Retinopathy Screening Campaign, which is highly rated. But the Scottish Diabetes Action Plan does need to be updated, building on the improvements of the past 12 years. And I understand, and the Minister will tell me if I'm right, that we may hear more of this fairly soon, and I think that would be welcome. But the Melbourne Declaration gives us the ideal opportunity in Scotland to reinforce our commitment to improving diabetes diagnosis and care, and to support the global parliamentary alliance now in place and focused on dealing with what has been described as a modern pandemic. I commend David-Stewart for bringing it to our attention. Thank you.
Many thanks. Now call on Cara Hilton, after which moves the Minister for the closing speech.
Thank you, Presiding Officer. I'd like to begin by thanking David-Stewart for securing this debate of great concern to people here in this chamber, in Scotland and across the world, and to further congratulate David on having had the honour to represent the Parliament at the first ever meeting of Global Parliamentary Champions for Diabetes in Melbourne. He's done a fantastic job in raising the profile of diabetes here in the Scottish Parliament. I'm sure we all pay tribute to that. As colleagues have already stated, diabetes is a major public health challenge. As the motion highlights, last year it was responsible for 5.1 million deaths around the world. That's 1 every 6 seconds. In my own constituency of Dunfermline, in Fife, in Scotland, around the world, the number of people suffering from diabetes is rising at an alarming rate. In Scotland, colleagues have already talked about the figures. It does look like we are on the brink of a diabetes epidemic, and the figures are extremely worrying for us all. In 2002, there were 150,000 people living with diabetes. By 2006, that estimate was 170,000. By 2010, again, it had risen to 228,000. Today, that figure is almost 260,000. What that means is that in just over a decade, we've seen a 42% increase in the number of people diagnosed with diabetes in Scotland. And when we factor in the substantial number of people living with diabetes but undiagnosed, we really are looking at a major public health time bomb here in Scotland. With a further 50 people diagnosed with diabetes every day, these are shocking statistics which are of deep concern to us all here today. Because the cost of diabetes is not just measured in the suffering of those afflicted with the condition, or in the impact on their families and friends. But as colleagues have already talked about, it's counted in the resources it uses within our National Health Service, within our social services, and in the productive lives it robs our society of. It's absolutely vital that we take action to tackle this costly disease, but also that we do more to ensure access to adequate care, treatment and medicines for those that are living with the condition, such as access to insulin pumps, to ensure a better quality of life for those living with diabetes. While not all diabetes cases are preventable, the vast majority of type 2 diabetes cases are weight-related, and the numbers are inevitably going to go up as the Scottish population grows older and fatter. A recent report by NHS Fife, for example, revealed that 1 in 5 primary 1 children in my constituency, Dunfermline, is overweight or obese. The same report found that 1 in 3 adults in West Fife is obese, and that only 1/3 of adults in West Fife do 30 minutes of physical activity a day. We're all rightly proud of Scottish food and drink, but the reality is, in most people's diets in Scotland, there's too much sugar, too much fat, and most people do too little exercise. And these are the key factors in the diabetes challenge that we face. If we're going to tackle diabetes successfully, we do need a complete change in our attitudes, but also small, simple steps will make a big difference, like taking the stairs instead of using the lift, having an apple instead of a piece of shortbread, walking to the shops instead of jumping in the car. 3 small steps that will make a huge difference in the long term. And we need to reach people early. The worrying obesity figures for children in Dunfermline show how important early intervention is. And here I'd like to highlight 5 councils Take Time for a Cuddle campaign, which was launched recently at the excellent Beanstalk nursery in my constituency. A campaign aimed at showing parents how making small behavioural changes can make big differences in their child's development and have a significant impact on their future life chances, reducing the likelihood of suffering conditions like type 2 diabetes later in life. While inevitably early intervention takes a long time to reap results, if we are to successfully tackle the growing diabetes epidemic in Scotland, then it's vital that we invest in early intervention. David's motion highlights the global nature of the problem, and there's a lot that we can do here to tackle diabetes in Scotland, but we've got to keep sight of the fact that it is a global issue. We need to continue to work with our colleagues across the UK, in Europe, across the world, to develop solutions and ensure people are aware of how to reduce the risk of type 2 diabetes and to address the common challenges we face. And I look forward to hearing from the Minister about how we're going to make sure that diabetes stays high up in the political agenda in Scotland.
Many thanks. I now call on the Minister to respond on behalf of the Government. 7 minutes are thereby, Minister.
Thank you, Presiding Officer. Can I, like others, offer my congratulations to David-Stewart in securing time for this particular debate, but also to take this opportunity to recognise the expertise he brings to the Chamber on this particular subject through his work as the co-convener with Nanette Millen and the cross-party group on diabetes, but also, as he mentioned in his own contribution, the 8 years he spent as Secretary to the All-Party Group at Westminster. And I think it should be duly recognised that this is an issue which you've been committed to for a considerable period of time, and to your credit as well. I also think the debate this afternoon has provided an opportunity to underline a very serious challenge which we face and which diabetes presents to countries across the world, and Scotland is not immune from that. And I want to try and spend a little time today outlining some of the work that's been undertaken to try and improve the lives of people with diabetes in Scotland. Also, the International Diabetes Foundation have estimated that 1 in 10 of the population will have diabetes by 2035. The Scottish figure for 2012 saw the number of people with diabetes increase to over 258,000. That's some 4.9% of our population, or 1 in 20 of our population. And I think these rather sobering figures just demonstrate the scale of the challenge that we face. I also very much welcome the renewed focus that the Melbourne Declaration on diabetes has brought to this particular subject, and also the work of the Global Parliamentary Champions for the Diabetes Forum. And I hope at some point they'll be able to come to Scotland as part of their programme in the years to come. And also recognise the important work that's been undertaken by the IDF in promoting the ethos of the Declaration in itself, to promote solutions for managing and preventing diabetes globally, as David-Stewart outlined in his own contribution. I think, as several speakers have recognised, Nanette Millen amongst those, thankfully in Scotland we are well placed to answer some of these challenges, and we're very fortunate to have outstanding clinical leadership here in the country, and we also have a very strong patient voice in diabetes within Scotland as well. And I want to take this opportunity in the Chamber to put on the record my thanks to Professor John McKnight and Professor Donald Pearson, and also to Professor Andrew Morris, that was mentioned to by Malcolm Chisholm, who have all chaired our Scottish Diabetes Group over the past decade and have provided excellent clinical leadership to ensuring that our diabetes services in Scotland are second to none. I also want to recognise the work that Sir Michael Hurst, as President of the IDF, has undertaken, and also Professor Steve Green, who chairs the International Society for Paediatric and Adolescent Diabetes, both fellow Scots and who have reputations which are highly regarded both at home and internationally. Our National Diabetes Programme, Presiding Officer, has helped to coordinate the safe, effective and person-centred diabetes care that we want to see being delivered across Scotland over a decade now. Many members are familiar with the Diabetes Action Plan and have made reference to this, and this has been key in driving forward the improvements in the number of important areas of diabetes care, including delivering state-of-the-art e-health solutions for monitoring progress, improving foot care services, increasing access to insulin pump therapy and enhancing the knowledge and skills of our staff within our NHS, both at an acute and primary care area. Now, I don't have sufficient time to go into great depth in all of the successes of our diabetes programme, but I want to take an opportunity to update members on a couple of key areas. A key measure of diabetes care in Scotland is our Scottish Diabetes Survey, perhaps the most comprehensive national record of its kind in the world. And one of the major issues to highlight from the most recent survey is that the percentage of people with diabetes who have had their foot risk recorded has more than doubled between 2008 and 2012. It's gone from just 31% to 70%. Now, this has a major impact on reducing foot ulcers and lower limb loss, and we want to see further improvements in how that service can be developed further. There is evidence that our world-leading system for foot risk triage system, which was developed by the Diabetes Foot Action Group here in Scotland, is working, and that people with diabetes are having their foot risk being properly assessed to avoid complications in future life. A second area that I want to highlight that we have made substantial improvement, and that's access to insulin pumps, which several members have made reference to, and Malcolm Chisholm made reference to with regards to his own constituent. Insulin pump provision for under 18s has increased from 8.4% to 22.6% across Scotland, and that's since December 2011. And we've also had an increase, a more modest increase, for those under 18. And as the member said, that he is a constituent whose daughter feels that they could benefit from an insulin pump. We have provided additional resource to our boards in order to allow them to make those available where it's clinically appropriate too. But I also think that the whole insulin pump issue has helped to be driven forward by the interest that David-Stewart and the cross-party group have had in this issue, the work of the Petitions Committee as well, and I'm sure the member is well aware that those boards who haven't come up to the mark have been left in absolutely no doubt from the government that we want to see further progress and to make sure they achieve the target that we have set for them. Members have also raised the issue of a national screening programme. National screening programmes are the government is advised on by the National Screening Committee. The most recent review of evidence on a national screening programme on diabetes and the modelling work that was undertaken by the NSC came to the conclusion that there was no conclusive evidence on whether screening should be undertaken or in which subgroup of the population would potentially benefit from screening. Now, in light of that review's findings, they recommended that the general population screening for diabetes should not be offered. However, this recommendation is presently under review, and we expect to receive further advice on screening programmes in May of this year. As members have also rightly highlighted, it's not about just having excellence in the quality of clinical services we offer to those who have diabetes. We also need to make sure that we take action in order to prevent diabetes from occurring in the first place. And the World Health Assembly global target to halt the rise of diabetes and obesity by 2025 is very much welcomed, and I think it will help to give added focus to this. we are taking forward a range of programmes in order to help to try and address healthy eating habits in Scotland, and we've taken forward work with a range of stakeholders to seek to achieve this. Last year, we funded Diabetes UK's Live For It school programme, which teaches children how to eat healthy meals and to be active, and how that can have a positive impact on their long-term health. This programme has been very successful, and we are giving further consideration how we can work with Diabetes UK to look at taking this forward in the months and years to come. Presiding Officer, I hope I've given members a reassurance that we continue to take this issue very seriously. We are committed to building on the progress that has been achieved under the Diabetes Action Plan, and to look at what further measures are required in Scotland in order to make sure we provide patients with the best clinical care, and that we also take forward the right measures in order to prevent diabetes from occurring in the first place.
Excellent. Many, many thanks. And I now suspend this meeting of Parliament until 2:30. Thank you.